In terms of an increase in visitation to long-term care homes, there was a thought that if it was successful, that perhaps it would open up to perhaps another family member or more frequent visits, perhaps. Is there going to be any changes there, and how is the system working to date?
Yeah, I can tell you, and as you know, I've been away for a week, but discussions have been ongoing about that. We wanted to give a period for people to adjust, to get those initial visits in, to make sure that people were comfortable with the protocols, and we are absolutely relooking at that.
And what we wanted to put in place, Cindy, was a system, and we did that on June 30th, or with guidelines on June 30th that could be put in place right away, and they have been. And every care home, assisted living home across BC, visits are taking place except in those facilities, except on Haida Gwaii in recent times, during the incidents of transmission there, and in the care homes that are under outbreak protocol. We put together the system for two reasons, and that's one designated visitor a week, to ensure that that can be managed with the other pressures on the care homes to keep people safe and to make sure that visits took place. What's also happening now is a process to add and support people to visit, and the expansion of that visitation will be partly the result of the review we're doing of visitation now, and partly will be greatly aided by the additional staff that will be provided to support care homes across BC in managing that visitation in the coming months. You recall that we provided to care homes for the period April 1 to June 30th, I believe, approximately $26 million retroactive. That the visitation plan is supported by $160 million in funding. That the single site plan, which is critical to keeping people safe in long-term care, and is a lesson that BC, I think, has demonstrated well across Canada, is a cost item of about $165.7 million. So those items are significant investments in long-term care. But we're going to do the same thing we've done with everything else, which is be methodical, be prudent, and to test out what we're doing before we move on to the next step, and that will be the same in this case.
I'm wondering if you can give us an update on testing procedures for workers in long-term care facilities. Are staff tested regularly for COVID, and if not, why? And can you also just clarify the BC death total? Is it 203 or 202? Because I think Friday it was reported as 202.
Okay, my mistake. My notes had said there were 2 additional deaths, and I knew there was just 1. So, but you're right. I misspoke. The actual total is 203, unfortunately, people who've died in BC. So, and there now I was distracted and completely lost the first part of your... Testing and long-term care. No, what we do and what we have done from the very beginning is it's about screening. It's about self-screening, active screening of everybody who goes into a long-term care or a hospital or a healthcare facility every day. So that means that I need to do a check and make sure, and I have to visibly walk through each of the symptoms that I could possibly have before I go into work. There's very low yield, and we've seen that in other provinces and other countries where they have done ongoing testing of asymptomatic healthcare workers on a periodic basis. That is, in my mind, not a great use of resources. We know there's false positives and we know there's false negatives. So what we are doing is focusing on the daily symptom screening that everybody must actively do, and is a very similar thing we'll be doing for schools as well. If anybody has symptoms, then testing is immediately available, and we have protocols, as you are aware now, where if a single case, either in a resident or in a healthcare worker or a visitor, is identified, then we have wide screening in that facility of everybody to make sure that we're picking up any potential cases once there's a real risk. So it's a little bit about understanding the parameters of the test and where it can be very useful for us without unnecessarily doing tests that aren't going to help us.
Do you have a follow-up, Tina?
Yes, please. And what is the protocol for notifying family members of residents in long-term care if someone in the care facility is infected, and if we could also possibly get that answer in French?
Sure. So we use the same protocols that we have on an ongoing basis for influenza outbreaks and other outbreaks. In this case, our sensitivity level is very low in that a single individual, and so each facility has a process for notification, and it's done in partnership with the health authority. Should a case arise in that facility, and we declare it as an outbreak with a single case. And each of our health authorities now has become very adept at making sure we have a team that goes and supports the facility to manage an outbreak. And you will have noticed that some of our more recent outbreaks have been limited to a single case, either in a resident or in a staff member, and that we're able to manage those outbreaks very quickly. So the notification protocol is part of the outbreak response that's done through both the health authority and the facility itself.